No streaks on your windows. Fireproof paint. These are some of the innovations we may soon see thanks to nanotechnologies that allow us to work with materials at the nanometric level. A nanometer is a meter cut into 1 billion equal parts. Nanotubes, one type of material, are 100,000 times smaller than the diameter of a hair. To give you another comparison, it's the same difference between a hair and a nanotube as between an oil pipeline and a hair. Nanotechnologies raise a certain number of questions regarding the possible toxic nature of the materials produced. In Belgium, the Walloon region has asked the University of Namur to analyze the potential risk to human health of these products. The project aims to develop tests for all nanoparticles to determine their toxicity, if any. Within the framework of the Nanotoxico project, nanoparticles produced by Walloon industry are studied. These include titanium and silicon carbides and nanotubes produced by NanoSil, a university spin-off. Nanotoxico is a multidisciplinary project gathering together research in 3 areas: classification of the materials, in vitro toxicology and health pharmacology, and communication. Because of their size, nanoparticles have new and novel physical and chemical properties. It's therefore indispensable to understand their impact on health and the environment. This first type of research is carried out by physicists and chemists who probe and explore the materials. Each type of particle is tested and weighed. Their particular shape, surface, and composition are measured. A most complete material profile possible is established through this classification process. Next is the analysis, studying the interaction of nanoparticles with living organisms and its consequences on human health. This is carried forward through in vitro toxicology research and then continued by the health pharmacology research. The aim of the in vitro toxicology is to reconstitute the human tissues representing principal access points that nanoparticles have to the human body. 3 tissue models have been developed to best represent the complexities of entering the human body. Skin is studied, produced by Straticell, another university spin-off. A section of the human intestine is tested. And human bronchial or lung tissue is also evaluated. Next, the health pharmacology research branch investigates and tries to confirm the results obtained with the in vitro models, using animal models. Toxicity studies are carried out on animals testing oral, skin and respiratory means of contamination. One benefit of this research has been the creation of a new inhalation technique in collaboration with the classification group. This technique permits the exposure of the test animals to a cloud of nanoparticles that is exactly the same as that experienced by workers. Finally, the Atout Science, wildcard science team works to inform the public at large through video clips, exhibitions, roundtable discussions, film debates, and via the website. Once the project is concluded, the toxicity tests can be confirmed and used as reference points in other studies of nanotoxicology. This data is of considerable aid for Walloon and European businesses. Under the new European REACH regulations, companies must supply health and safety as well as environmental information about the industrial chemical products that they use and produce.